According to the United Health Foundation, Oklahoma ranks 49th in the nation for the number of primary care doctors. Of the 77 counties in the state, 64 have a shortage of health providers. Telemedicine is helping doctors reach more patients, especially in rural areas, and new laws regarding virtual doctor visits could change the way all of us visit with our physicians in the future.
Hi, Dr. Ramos. How are you doing today?
Dr. Joe Johnson is chatting with colleague Dr. Lee Ramos, who's taking part in the examination of Susan Wesson from miles away via a video call. Wesson's pregnancy is considered high risk because of her age and her recent history.
With the two miscarriages that we had after that, it was really just touch and go, and it was really hard. And we just had to come together and, just give it to God and just let him take care of it.
The couple is hoping the ultrasound will bring encouraging news.
Okay, well, baby's head is down. If you see anything concerning or that you'd like to take another look at, Dr. Ramos, please let us know.
I mean, at this point in time, I don't see anything concerning, and I think that the pregnancy is going as great as can be expected. Yeah.
How did today make you feel?
Awesome, seeing he's growing healthy and strong, and it's exciting to see that he's totally on schedule.
Dr. Johnson delivered Jamie Calkins' identical twin boys 4 months ago. Like Susan Wesson, Calkins' pregnancy was also high risk, but for different reasons.
They were in separate sacs, which was great, but they shared a placenta.
A shared placenta could have placed one infant at risk if the other got a bigger supply of blood or food from their mother. Dr. Johnson wanted Jamie seen by specialists in Arkansas.
On the other end of the camera through telemedicine, their maternal fetal medicine doctors and their high-risk nurses were looking at my ultrasound at the same time.
Dr. Johnson says in the future, telemedicine across state lines will be commonplace. Today, more Oklahomans are being reached by telemedicine than ever before.
There's over 110 different locations that can telehealth into the OSU system. Everything from neural stroke, high evidence related with diabetes. We have the Ryan White HIV clinics upstairs through internal medicine. They have linkage to where they can follow and monitor patients in rural type areas.
Telemedicine is exploding right now.
Steve Cassidy is the director of telehealth for the OSU Center for Rural Health. He says a law which went into effect September 1st activates new regulations from the Oklahoma State Department of Health.
The new rules and regulations allow any service that a physician feels can be treated properly and appropriately via telemedicine to be done that very way.
Cassidy says the new rules allow doctors to bill any patient seen through live telehealth appointments at the same rate as an office visit.
Also, before September 1st came, only rural residents were able to be treated via telemedicine. Today, even our urban residents in Oklahoma can receive telemedicine services.
He says as more urban hospitals and medical practices launch telemedicine services, more of us may be seeing a physician in the comfort of our own homes.
You can see a doctor on average 20 minutes for your ailment from your location using your computer, tablet, or phone, and that physician will provide the treatment that you need and call in any medications that are necessary as well.
Telemedicine will remain extremely important to people living in rural Oklahoma where doctors are scarce. The OSU Mobile Medical Unit is critical to tens of thousands of Oklahomans. Inside, as patients are attended to by nurses, the doctor on the other end of a camera can perform virtual physical exams on patients.
Now, I'm going to look through here, but what you're going to see on the TV is exactly what the doctor at the other end is seeing, which is the inside of your ear.
Rural hospitals also lack expensive medical equipment that is only available in Oklahoma City or Tulsa. Sophisticated diagnostic equipment is on board the OSU Mobile Cardiac Unit, which visits several rural hospitals each week. At Drumright Regional Hospital this week, heart patient Rachel Anderson was one of many tested.
I don't drive to doctor's office and stuff because I have too many anxiety attacks. And for me to come to Tulsa, no.
The cardiac unit can do ultrasounds on veins, run various stress tests, and with nuclear medicine, they can see how well a heart is performing. Lisa Carver is the clinical coordinator of the mobile operation.
So say we're in Tallahena, and we just transmit our data, and the doctor in Tulsa is looking at it immediately.
She says if a serious problem is found, a doctor may order immediate hospitalization.
We definitely have had instances where we have, I can say 100% saved lives.
While 64 of the 77 counties in Oklahoma have a shortage of primary care doctors, 69 of the counties lack mental health professionals.
One of the problems in providing mental health care to Oklahomans is the sheer lack of psychiatrists.
Dr. Jason Beeman is chairman of the Department of Psychiatry and Behavioral Health at OSU Medical. He says by summer of next year, people with serious mental health issues living in rural areas will start benefiting from telemedicine.
We will be providing services to the Oklahoma Department of Mental Health facilities, hospitals and outpatient centers via telehealth. So it helps to break up the backlog that they have in patients that need to be seen that aren't being seen often enough. We will be able to provide some of those services as part of the residency.